The High Plains is in the middle of flu season, and the area is also seeing an uptick of other respiratory illnesses like RSV and COVID-19. With this uptick in cases comes a shortage of medication to fight them. We spoke to a local pediatrician and pharmacist about the shortage and how to keep your family healthy.
We are seeing a tremendous amount of RSV and flu. A couple kids getting COVID every now and then, but mostly it's been RSV and flu. And compared to the previous years, it's pretty nasty.
Dr. Anders Leverton, a Texas Tech physician's pediatrician, says this year's admissions look similar to before the pandemic. It's not the worst he has ever seen, but it is a change from recent years, and the thought is due to kids not being exposed to those common viruses during the pandemic. He adds that the city of Amarillo is essentially out of one common medication used to combat the flu, Tamiflu. Dr. Leverton says if you don't have Tamiflu, don't panic.
That doesn't mean you can't get better. The same like RSV with flu, you want to treat with fluids, supplemental care, supportive care, making sure that your child's staying hydrated, and just keeping a close eye on them.
Mark Vogler, pharmacist at Martin Tipton Pharmacy, adds that they are also seeing a shortage of Tamiflu and amoxicillin, as well as certain over-the-counter fever-reducing medications. But Vogler says they are working to make sure patients have those medications.
We're having to compound several of those for doctors. Those will have to be patient-specific, but we can compound some of those to get around these shortages. Don't find one at one store, keep calling around, and if you don't find it that day, call the next day and see if we've got it, because we're always on top of it, trying to get in what we can for people from various manufacturers.
Dr. Leverton says the flu symptoms should last 7 to 10 days. If you have a fever lasting longer than that and you are on Tamiflu or other treatment and not getting better, then you should be checked out by a physician. The state says